The ear, nose, and throat department at Pittsburgh is the biggest academic department in the United States. And we currently have 42 doctors, and almost everybody is super specialized. Academic doctors are charged with teaching the next generation of physicians. The other big difference between private practice and academic medicine is we do research. What we're trying to do is identify new treatments, new instruments, better medications, so that the world of medicine is better tomorrow than it was yesterday.
When someone finds out the first time that they have cancer, there's shock, there's a concern. I recognized early on that I had a fabulous doctor and with a tremendous medical team that gave me the positive attitude. I'm John Nicotra, been a patient of Dr. Johnson since 1998. Currently, I am patient advocate for SPORE, Specialized Programs of Research Excellence.
There are approximately 45,000 new cases of head and neck cancer each year in the United States, but this incidence appears to be rising and appears to be primarily due to a new cause for head and neck cancer, which is the human papillomavirus. Head and neck cancer is a really devastating disease. Historically, what we've been able to do for patients is cut out their tumors. But often when we cut out the tumor, we leave them with disabilities that are really difficult to manage. The other standard therapies are chemotherapy and radiation. And while they're effective when given in combination, they're hard to take, and we need to do better.
When you've seen one tumor, you've seen one. And I think we see this a lot. And in the blood or in a patient's tumor, often we can discover a protein, otherwise known as a biomarker. This allows us to develop better treatments and understand why a therapy may need to be shifted to something that works better. At the University of Pittsburgh, we think we're at the cusp and the forefront of that, in part because of the resources devoted and the generosity of our patients to help donate blood and tumor specimens.
The University of Pittsburgh Medical Center is unique in that we have the largest number of dual console robotic systems in the country. This allows two surgeons to operate on a patient at the same time. For using the robot, we can actually avoid these external incisions. This really reduces the disfigurement that patients suffer from, and it significantly improves the quality of life. Not only that, but these patients are able to return to work in a much quicker fashion. The natural future direction from this is to develop new technologies and new tools to improve the care for our patients with robotic surgery. We have established a collaboration with the Carnegie Mellon University and their excellent team of robotic scientists to bring together a group of scientists and surgeons and really bridge the gap between basic robotic science and clinical care. This is truly a translational effort and is in fact the first in the world to address this important problem.
These people are not only physicians, they are also involved in research to find cures, to find the best possible treatments that are available.
Before Madeline received the treatment of her ear tubes, it was difficult. We had to do several trips to the doctors for her ears when she was sick. Then we'd have to go back for rechecks to make sure that the medicine was working properly. Ear infection after ear infection after ear infection, so the pediatrician said, "Let's go to Children's and see what's going on."
I wouldn't hear anything, but I saw someone's mouth moving. So I knew someone was talking, but it was hard for me to hear them.
Otitis media, or ear infection, is the most common next to the common cold in children. By 3 years of age, at least 50% of the children had had 3 or more episodes.
I work in pediatric ear, nose, and throat. I do research in the ENT Research Center. We have a series of projects that are funded by the National Institutes of Health to look at various groups of children that are known to have a lot of ear disease. They obviously have problems with the back of their throat. The hope is that we will identify the differences between those groups of children, and the differences are the things that lead us to treatment choices.
The information that they gather from these research studies, it benefits not only Madeline, and it benefits other children and throughout the community.
It's estimated that 32 million people in the United States have hearing problems or report difficulty with their hearing. That amounts to nearly 10% of our population. And as you get older than 75 years of age, 50% of people will have hearing problems.
It was a little scary at first because I wasn't sure I was ready to acknowledge the fact that I had a hearing loss. When I was in meetings, people at the end of the conference table, I could see their lips move. I could hear partly what they were saying. But as sometimes happens when people trail off at the end of their sentence, I was missing all that. What I have is completely in the canal hearing aids now. Probably most people that I work with don't know that I have hearing aids. They're very small, they're very unobtrusive, but my life is so much better inside and outside of the work environment because of what they were able to do for me.
Audiologists focus on hearing protection whenever possible, which is why we started the Musicians Hearing Center in 2003. Noise-induced hearing loss is 100% preventable. Some hearing losses are not preventable and may be permanent. The good news is hearing loss is 100% treatable.
The hearing in my right ear diminished to the point that I basically had little to no hearing in that ear. I wasn't able to speak with people. I hadn't had an experience of hearing loss for any extended time, so I wasn't accustomed to reading sign language or anything of that sort. Just everyday activities were quite frustrating and quite demanding. When I first received the implants, just being able to hear, which you take so much for granted, to have been lost, and in my case, in somewhat of a sudden manner, was quite startling and quite depressing. And then now to be able to experience that again is quite profound. As I say, it's a minor miracle.
In the temporal bone lab, we have residents practice different surgical procedures. Cochlear implant surgery is one of the procedures that we actively teach in that setting.
I'm interested in understanding the anatomy underneath deafness. We have different animal models to mimic pathologies that may happen in humans. We use molecular approaches to understand how the proteins are, where they are in the brain, and also detect any change that is important. We hope that that will provide tools for the development of treatment strategies in the future.
I had a high-frequency hearing loss, which is what probably was causing my tinnitus. And it just continued to grow louder and louder. It caused me not to be able to sleep. I really could not function effectively at work, and eventually took 3 months off my job.
10 to 15% of people in the United States probably have tinnitus, and many of them come to medical evaluations because of their concerns. Occasionally we can identify a real source, and in that situation we can provide specific treatment.
There was counseling, and I was fitted for these sound generators, which helped to retrain my brain. They said they were going to retrain me not to be aware of this, and they did it.
Despite the prevalence of tinnitus, there's currently no effective cure. The Department of Otolaryngology, together with UPMC and the University of Pittsburgh, is dedicated to solve this mystery. So they brought together a group of international neuroscientists who work closely together to study the biology that underlies the perception of phantom sounds.
We've managed to develop an animal model of tinnitus, but on top of that, we have now some new imaging techniques. We're trying to understand what are the changes that have occurred to create these hyperactive circuitries. So if we manage to understand what happens in the auditory system, we'll be able to cure the development of tinnitus, and we will be able to stop tinnitus from becoming permanent.
As a worldwide problem, for those people who suffer from it, if a cure could be found, that would be amazing.
I have bilateral vestibular loss. It throws my balance off and also sends the signal to my eyes to move when I'm moving. So anytime I'm moving, everything's shaking. I fall, I lose my balance a lot. I crawl up the steps. I can't go anywhere with lots of lights like stores, which was where I work. I used to be able to play soccer with the kids, run around the yard, do yard work, mow the lawn, dance.
1 in 3 Americans report dizziness to their doctor. 7.5 million people each year go to their doctor for their dizziness. Those disorders can be caused by problems with the inner ear balance mechanism or the brain.
Tests that diagnosed me were the rotating chair test, and then they put water in both my ears and then ice water in both of my ears. It was a godsend to have Dr. Furman be able to diagnose me and tell me what was wrong, and that they're working on products that will help me in the future.
We believe that we can help most people without surgery. In our team, we have neurologists, physical therapists, and engineers who all come together and work on the same problems. This is very important because there's not one specific treatment that can be used to solve all dizziness and balance disorders. We've developed this display booth where a person acts and feels like they're walking through a virtual grocery store. What we have found is people have an improvement in symptoms and balance function after they've gone through this trial. Another thing that we have is what's called a vibrotactile feedback vest. And this is used to give people tactile cues that can tell them when their body is moving too much in one direction or another, and it allows them to move their body back to a center position.
Our concept is to deliver the best care we can and improve treatment options.
I went to physical therapy and they helped me with some exercises. Now I know I can live like this.
We're certainly enthusiastic about the potential opportunities that we have to make a difference in the lives of our family and the people in our community. Research is real. It does make a difference. But you might ask, what are the impediments? What holds us back? Currently, we're the third leading organization in ear, nose, and throat research in the country in terms of support from the NIH. Be that as it may, we still come up short. It takes extra dollars to do pilot projects, to explore new areas of research, to try things that have never been tried before. We do research so that the world of medicine is better tomorrow than it was yesterday.